safeguards in place, and people are protected in so many ways.
Right.
Yeah,
Well,
not
that's
100%, but
Not
there's
100%.
always problems. But
Right.
Sure. Now, I have an issue that I've been working on for a long time. I've filed legislation to try to repeal it, and that is the user fee that private patients are being charged in nursing homes. And many of the family members have no idea that this it increases every year. So right now it's $11 a day plus so many cents. But it's factored into their daily charges, and you can imagine if you did your math, $11+ a day amounts to more than $4,000 a year in Massachusetts state taxes. But it's not called a tax, it's called a user fee, which means even if they knew that they were charged this fee on a daily basis, they cannot take it as a tax deduction because it's a fee and not a tax, when actually I call it a tax. But what I know, I have filed legislation now. This is my third year, because I filed it 2 years ago, and we almost made it. Senator Sue Tucker from Andover had it all squared away for me. She and her committee, I have to give her committee a great deal of credit for it. But they come last July 1st, it would have been phased out in 3 years so that it would not have been a burden to anyone. And so we had come to that, and then it got stuck in the Healthcare Financing Committee and just died at the end of the year. And so after going so far and being right there at the point where we were repealing it, and with the help of the elder committee, that Elder Affairs Committee, that it just didn't make it. And I think that was a travesty, because why should people in nursing homes pay this tax or fee when they're paying enough for their care in a nursing home? They're not a burden to the Commonwealth, and their family members are paying for their care right out of their own pocket. So what can we do to get more support? Because I refiled it this year, and so it is there, and I'll be supporting it again, that is supporting the repeal.
Right.
And hopefully, I know that I have seen this year especially, not only did I file the bill, but many legislators have filed the same bill. So it seems to me that more people are aware now that there is a fee in these daily charges, and it shouldn't be there.
in fact, there was a hearing on this recently on Beacon Hill. It's called the bed tax.
The bed tax.
Yeah, it may not be a common term out in the public, but they call it the bed tax, which is what it is. It's a form of double taxation, because the private pay people who are paying that tax also through their taxes are helping to pay for the Medicaid program, which of course is one of the major underwriters of nursing home care to begin with. So they're already paying their taxes, which go to Medicaid, and on top of it they pay a second tax because they happen to be sick and in a healthcare institution, which means that the only people who pay it are people who are infirm, which right away strikes me as an unfair situation. It's a sick tax, if you will, on people who happen to be disabled enough that they need nursing home care. What I don't understand is why, if we're going to pay for nursing home care, let's all of us, including healthy taxpayers, let's all continue to foot the bill if we have to, and increase our contributions that way, rather than saying to people, if you have the misfortune of not being able to be kept at home but have to go into an institution, we're going to slap you with a sick tax to penalize you. If you stay home, we won't charge you that, but if you go into a nursing home, we are going to charge you $4,000 extra.
Right.
Now, half of that money, Sally, $288 million, by the way, is raised by this tax. Half of it goes to the nursing homes, and half of it comes back to the Treasury in Massachusetts, because federal taxpayers pay for half of that. So whatever gets raised here gets matched by the federal taxpayer, who is us.
Oh, of course.
So you see, we're paying for this in a variety of ways.
Right.
And all of it is sort of economic, bookkeeping gimmickry to give the nursing homes more money. And again, we don't want to deny nursing homes the money they need to operate a quality institution. But this is not a fair form of taxation. It singles out one kind of individual who's sick. And I agree with you that they ought to repeal the tax and just instead raise if they have to, the Medicaid contribution that's paid for by all American taxpayers, not just those who are sick.
That's right.
But you know why it's not passing.
Yes, I do know why it's not
There's
passing.
something called the nursing home industry.
Right.
And it's a powerful lobby, and they spend a
Right.
lot of money taking people out to dinner
Right.
and making contributions to fundraisers. So that's why Sally Hoyt doesn't have her bill, is the nursing home industry is standing in the way of you and a piece of legislation.
Well,
But ultimately,
they're too big for me. I don't get paid.
No,
and they
no,
do.
Oh,
you
no.
keep
Because
doing
see, what
it.
you asked the question of what can we do, and what we do right now is what is part of what the work of getting the word out to the public,
Educating
about
people.
what they need to understand, and frankly, ultimately, if the legislators hear from their constituents across the state that this is an unfair tax, they're going to listen. I have faith in the system. I think we all work in the system, and we've done some good
That's
things, and
right.
we've had some obstacles, and
Right.
we've had some defeats over the years. But
Absolutely.
we're in this for the long haul,
Right.
and ultimately, if we keep at it, and you keep at it, and together we get a coalition of consumers and advocates saying this is not the right thing to do, I'm confident the legislature will ultimately do the right thing.
Well, and just as the Estate Recovery Act took us, I think, 6 years before we got that repealed. I'm hopeful it won't take 6 years. I'm hopeful that this year or this term, this session, we will be able to repeal that tax. But as you, I'm sure, remember the Estate Recovery Act, I worked darn hard to repeal that bill, and I have to say that the Silver legislature really did a great job, because
Yes.
I wouldn't let up until we repealed that bill.
That's right.
And as you know, what happened was if a person was on Medicaid or Mass Health, and in a nursing home, then after the person passed away, the estate or assets of the deceased person would have a lien on them to recover dollar per dollar that was spent on the person who was receiving help from the Commonwealth.
Right.
And so that was really a nightmare for a lot of families, because they had no idea that this could happen to their assets. They thought it was going on to their children, or the children would inherit the assets of the person who was deceased. But they had to go through removing the liens, and they had to share their inheritance with the Commonwealth, and so it became quite a nightmare. But we did finally repeal it. I think it took us about 6 years, but we did. So we're hoping it won't take that long to repeal the user tax on private patients in nursing homes, but that tax has got to go. So, do you have any further information you'd like to share with the public? And I'll just let you go ahead and say your thing at this point, because I do believe that all of the questions that I had for you have been answered, and answered beautifully, and I'm sure the public has learned a great deal.
I'll let Al have the last word, but from my last word would be, again, if I can just encourage the viewers to make the call.
Yes.
And they should call 1-800-AGEINFO and press 3. And that phone number will connect you toll-free to an agency like Mystic Valley Elder Services, no matter where you live in the Commonwealth of Massachusetts. So whether it's for home care services, information about long-term care, housing, insurance, counseling, elder protective services, that's the phone number to make the call. And make the call is sooner than later. We don't want to have people have regrets.
Thank you, Dan. And now?
I would just add that home care is your civil right. Go get it.
You're right. It is everyone's civil right, and we should all know it. Thank you very, very much. It's
a
been
pleasure.
Thank
very
you, Sally.
informative afternoon, and I've learned a lot too. So it is a day of learning, and as they say, it's never too late to learn,
Absolutely.
and to know more, and to be able to put these things into action. So if the public has any questions, don't hesitate to call us, and they certainly know where to find me. So I'm happy to be of assistance at any time. And thank you again for gracing us this afternoon with all your talent and information, and we certainly do appreciate it. Thank you very much.
My pleasure, thank you.
Thank you.